DogWorks Radio is sponsored by Alaska Dog Works. Check out their website at alaskadogworks.com. You can support this podcast on patreon.com/firstpawmedia.
This episode of the podcast is brought to you by First Paw Coffee Company, specializing in private label premium blend coffee. If you're serious about coffee, you should check it out. First Paw Coffee's passion is high-quality, small-batch roasted coffee. They take the extra time to taste and get everything perfect before they release new blends. They aim to bring you a cup of happiness each time you pour yourself some coffee. Find out more at ak.dog/free and enter for a chance to win some First Paw Coffee prizes, a book from our collection, and tote bag. One winner will be selected at random each month. That's ak.dog/free.
Being proactive about preventative health is one of the best ways to ensure that your dog enjoys a long and happy life. But what questions should you be asking your veterinarian to ensure that you're doing your part to keep your dog healthy and lower the risk of illness, disease, and injury? We've put together this list of the 10 most important questions you should ask your vet to arm you with the need-to-know information all dedicated dog owners should know.
From First Paw Media, sponsored by Alaska Dog Works Professional Canine Training Center in Anchorage, Alaska. This is DogWorks Radio, committed to families and their dogs to build lifelong and fulfilling relationships. Visit our website at dogworksradio.com. Now here are your hosts, Robert and Michele Forto.
Hello and welcome to DogWorks Radio. This is your host, Michele Forto, and I'm the lead trainer of Alaska Dog Works. Here, we help owners and their dogs have better relationships. On today's show, we are going to take a deep dive into 10 questions that every dog owner should ask their vet. We all know that sometimes taking your dog to the vet can be overwhelming. Most of the time, it is a visit just for a checkup for annual vaccinations. But did you know that a lot more can be done to ensure that your dog can live life to the fullest? Let's jump into those questions, shall we? 1. Should my pet have tests for hidden diseases? What lab work do you recommend for my pet? Well, Dr. Barry Neeshan, Chief of Staff at ABC Veterinary Hospital in San Marcos, California, says blood analysis is a vital tool for screening out disease. Even pets that appear happy and healthy can have hidden medical problems that might grow serious, even life-threatening, if left undetected. Blood tests are essential for identifying diseases at the earliest, most treatable stage possible. He goes on further to mention that pets can tell us when they're ill. That's where lab tests like blood analysis come in. Even young and healthy pets, lab testing gives us a valuable baseline picture of what represents good health for your individual pet. A recommended part of your pet's annual exam, blood tests can spot health trends sooner, before they become more serious. Standard blood test panels for dogs and cats routinely check for many problems commonly. Complete blood cell count, or CBC, provides important information about the types and number of blood cells in your pet's blood. A low red blood cell count, for example, indicates anemia, while a high white blood cell count can indicate an infection, chronic inflammation, or other disease process. Blood chemistry profile is particularly important for evaluating organ function, like your liver and kidneys, electrolytes, blood sugar, screening for the presence of an endocrine disorder, etc. Any abnormalities will help decide on further diagnosis, tests, or treatments. A heartworm test can detect evidence of heartworm disease. For a more complete picture, they will often combine a blood panel with other tests such as a urinalysis and fecal examination. Question number 2. Which vaccines should my dog receive? Well, Dr. Paul, he is the owner of the Pelican Mobile Pet Care in Anguilla. He says the vaccines that your dog should receive are the core vaccinations that prevent diseases, are extremely widespread in their distribution, and are easily transmitted. These diseases are commonly fatal or extremely difficult to treat effectively. One core disease, rabies, can be transmitted to humans with potentially deadly results. In summary, core diseases are the more contagious and severe diseases. Core vaccines provide long-term immunity, making yearly vaccination unnecessary. Core vaccines include canine distemper, canine parvovirus, canine adenovirus 1 infection, and rabies. Historically, these vaccines were recommended yearly, but this is no longer the case. Duration of immunity from these vaccines has been proven to be at least 3 years. Rabies vaccines are sometimes administered more often based on state and provincial regulations. While not all vaccines carry a label that indicates they are effective for 3 years, current recommendations for core vaccines are that after the completion of an initial series, dogs should be revaccinated every 3 years. Non-core vaccines protect against diseases that do not meet the core vaccine description. While all dogs are at risk for core diseases and must be vaccinated, risk of exposure, likelihood of infection, and severity of disease should be evaluated when making non-core vaccine recommendations. The indication for these vaccines should be based on a risk assessment that looks at local and regional incidence of the disease. The risk assessment should also take lifestyle into consideration. Non-core vaccinations may include leptospirosis, Lyme disease, canine cough complex, canine influenza. These vaccines generally provide a shorter length of protective immunity, and dogs that are at risk for infection should be vaccinated every year. Question number 3. How often should I schedule examinations? Well, Dr. Marty Becker of America's Veterinarian, author and veterinary contributor on ABC's Good Morning America, states that annual examinations, or at least twice yearly for some pets, are the cornerstone of a good preventative care regimen, and preventative care is critical for your pet's health. You may even save money when you can work with your veterinarian to tweak your pet's care in order to prevent health problems from occurring. Changing his diet, for example, to help prevent or reverse obesity, or to catch and treat illness earlier, hopefully before it can adversely impact your pet's quality of life. The approval of another year's worth of heartworm medication, as well as a review of all other medications, is part of that process. I know many people accept the need for that first heartworm test but balk at subsequent ones. They argue that they've even given the medication as prescribed and their pets should be heartworm free. Problem is, we're only human. Studies show that about a quarter of all pets don't get all their heartworm doses, leaving room for infestation. Your veterinarian needs to make sure your pet isn't carrying these parasites despite your best intentions. That means you'll need to take him in for a heartworm test at regular intervals. Question number 4. What is the ideal weight for my dog? Molly McAllister, DVM MPH Senior Manager of the Banfield Applied Research and Knowledge, or BARC team, says the ideal weight for a pet can depend on the breed and size of the individual pet. The best way to judge is if your dog is at his ideal weight is to use body condition scoring. Our State of Pet Health report describes the body condition score and shows you how to perform this. Question number 5. What is considered adequate and appropriate exercise for my dog? Dr. Susan Nelson of K-State Clinical Associate Professor, Pet Health Center, lets us know that dogs, like people, reap many benefits from exercise. She said there are physical and mental health advantages for the dog owner and the dog when they exercise together. Nelson goes on further to say exercise is important, but dogs differ in the amount and types of exercise they should be doing to maintain good health. A blanket recommendation for exercise time amounts can't be given, as exercise needs vary vastly between individuals, and factors such as age, breed, weather, and general health all influence the amounts of exercise your dog will need. Nelson says to consider these guidelines. In general, larger and working dogs have higher energy needs, and smaller toy breeds need less exercise. Ideally, dogs should get out twice daily for exercise. Times may vary from 15 to 60 minutes depending on your individual pet. Turning the dog loose in the backyard isn't enough. Aerobic exercise should be continuous with few breaks. Most dogs are content to lie in the sun and only get up for short periods of activity. If the dog has another dog it can run around with outside, that could be sufficient if they spend long periods of continuous play, but don't rely upon that in most circumstances. Nelson goes on further, saying there are many generalities when it comes to exercising with dogs, but they are just generalities. For example, though many small dogs prefer lighter activities, Jack Russell Terriers tend to be very high-energy pets. Here are some generalities for activities to do with your dog depending on its needs and interests. Medium and large dogs typically make better long-distance running partners. If your dog can run longer than you are able, you may want to consider biking while having your dog run beside you on leash. Pay careful attention to safety if you choose this option. Smaller dogs are better suited for shorter distance running or walking.
So earlier you learned about First Paw Coffee Company, and now I'm going to tell you about its Tail Wagger Blend. First Paw Coffee Company's Tail Wagger Blend is their first offering, and its name and label were crowdsourced from their Facebook fans. How cool is that? The Tail Wagger Blend is a private label premium blend that was developed just for them. It is a medium roast from Colombian beans with tastes of Brazil nuts, grapefruit, and oak. Be sure to go to ak.dog/free and enter to win a bunch of cool prizes. That's ak.dog/free.
All right, you guys, I'm going to let us continue where we were. We're on question number 6. What diet should I feed my dog, and how often should he be fed? Well, Dr. Eric Barchis, medical director of the San Bruno Pet Hospital, lets us in on what he considers the best advice. Dogs, like us, are advanced mammals. Their physiology and biochemistry is no less complex than ours. And that means that at this time, nobody knows what is the ideal diet for a dog. That doesn't mean there aren't plenty of people who think they know what is ideal, and goodness knows some of them like to make noise on the internet. Some of these folks espouse theories that seem logical and sensible, but they're not yet proven. Some of the major pet food manufacturers have research facilities where they have fed dogs nothing but their brand of commercial food for many generations. These groups of dogs are alive, well, and healthy with no nutritional deficits. This is taken to mean that the diets are complete and balanced. And indeed, from a scientific standpoint, it is hard to refute the claim that a diet fed exclusively to many generations of dogs must be complete and balanced. But that doesn't mean it's ideal. There almost certainly could be some way to make the diets better. How about the folks who advocate for grain-free or raw diets? They often claim that such diets are more species appropriate, since wild canids usually limit their grain intake to that which is found in the gastrointestinal tracts of their prey. In theory, this makes sense, but the theory's not proven, and it also neglects the fact that dogs are no longer wild canids. They co-evolved with humans, and as we started eating grain, no doubt, so did they. Developing countries currently offer a pretty good idea of what the canine ancestral environment looked like, and in those places, dogs eat human leftovers and refuse. In those places, dogs eat what humans eat. My body, like all human bodies, can thrive on a diversity of diets. I have no idea what the ideal diet is, but so far in my life, as long as I have consumed food in moderation and engaged in plenty of exercise, I have not suffered from any nutritionally mediated problems. Canine bodies are equally versatile. I know an awful lot of healthy dogs. I know dogs who are thriving and in perfect health on commercial diets. I know dogs who are thriving and in perfect health on grain-free or raw diets. I know dogs who are thriving and in perfect health on homemade diets. Is one of these diets the ideal one? Is there even such a thing as an ideal diet? Despite all of the hype and the noise, nobody knows, and nothing is proven. However, in the next 15 years or so, we may learn a great deal about this subject. The currently running massive lifetime golden retriever study will be monitoring the health of a huge group of dogs fed different diets. By the end of the study, we may know which diet is ideal, or we may learn that there is no such thing as an ideal diet at all. Or, let's face it, we may simply learn that we don't know much at all. Question number 7. Are there supplements or natural remedies that would help my dog? Dr. Jessica Vogelsang, editor of Paw Curious with Dr. V, lets us in on a few of her opinions about supplements and natural remedies for our dogs. The pet supplement industry brings in over $1 billion a year, so clearly lots of people think so. A better question is, should I give my dog supplements? The answer to that depends on what you want to give and why. Here are some of the most commonly used supplements. Joint and arthritis support. One of the most popular categories in supplements is joint support, and with good reason. Glucosamine and chondroitin sulfate are widely used in both human and veterinary medicine and are well accepted in the medical community as a safe and effective complement to more traditional medications. I often recommend these for senior pets, particularly larger breed dogs who are often prone to joint disease. Skin support. Or EFA, essential fatty acid supplementation, is a mainstay in many veterinary dermatology offices for its anti-inflammatory properties and for its ability to strengthen the skin's function as a barrier. Fish-based fatty acids have a more optimal ration of omega-6 to omega-3 fatty acids than vegetarian-based EFAs such as flaxseed. Gut support. Got a flatulent dog or one who always seems to be suffering from midnight bouts of diarrhea? Probiotics intended to flood the GI tract with good bacteria are often helpful for mild cases of GI upset. Liver support. A healthy pet should not need a liver support supplement, but in dogs with specific liver conditions, milk thistle or SAM-E can help reduce inflammation and improve liver function. Veterinary-specific formulations exist and are my go-to for dogs that would benefit from them. Vitamins. Commercial dog diets are formulated to meet very specific nutritional guidelines, meaning they all have the critical vitamins and minerals your dog needs. Only time I usually recommend them is if you are feeding a home-cooked diet or other diet that needs those additional supplementations. When in doubt, ask your vet. Question number 8. Should I purchase pet insurance? Well, Dr. Rob Sharp of Hillsborough Veterinary Hospital says every day I handle any number of routine visits to my office. I spay and neuter animals, clean teeth, administer vaccines and heartworm medication, distribute flea products, and even address behavioral problems, all of which costs money, and none of which is covered by most pet insurance policies. That said, I also routinely refer cases to specialists for treatments that can run thousands of dollars. At such times, insurance seems to be a godsend. Buying insurance, after all, means placing a bet that disaster will someday strike. And like any seasoned gambler, you should spend some time assessing the odds. First, consider how much a policy will really cost you in the long term. A basic plan for a young dog runs about $50 a month. The average lifespan for, say, a Labrador Retriever is 10 to 12 years. So you'd be looking at an annual cost of $600 or $6,000 to $7,200 over the estimated lifetime of that lab. The smaller the dog, the longer his lifespan, so adjust accordingly for a teacup poodle or Great Dane. It's also worth taking a good hard look at yourself. Are you the type of owner who would pursue all possible avenues to save a beloved pet? Radiation for an ailing bulldog, perhaps, or knee surgery for a 10-year-old Labrador? If so, insurance might make more sense for you than for the person likely to forego treatments that seem overly invasive or heroic. Finally, determine exactly what your pet insurance policy will cover. Most plans have a $50 deductible per visit and pay roughly 90% of all covered costs. This usually excludes routine procedures like rabies shots and hereditary matters, including common ailments like hip dysplasia in bigger dogs. But insurance does cover large unexpected catastrophes, such as a pet who has been struck by a car or an aging animal who requires treatment for cancer. Still unsure? Have your veterinarian look at the policy you're considering to get a professional opinion and the odds of your pets having a disorder or accident that's covered. For the record, in my practice of more than 4,500 client files, I can find only one insured dog. Question number 9. How do I prevent dental disease? What do you recommend for dental care? Dr. Patrick Mahaney, holistic house call veterinarian and certified veterinarian journalist, says, in my veterinary clinical practice, I am very passionate about my patients having healthy and clean mouths. Periodontal disease and obesity are the two most common diseases I diagnose. While both conditions are entirely preventable, the negative consequences associated with each are often irreversible. My own dog, Cardiff, has immune-mediated hemolytic anemia, or IMHA, a typically fatal condition potentially caused by excessive immune stimulation from inflammation and infection. My goal is for Cardiff to never experience another hemolytic episode, so I've established a daily routine to minimize bacterial accumulation in his mouth. I alternate between using a toothbrush and cleaning with a circular fabric swab impregnated with an antiseptic called SHMP. How did I establish this method of daily oral cleansing for Cardiff? I sought guidance from an expert in the field of veterinary dentistry and included my perspective based on practicality and independently researched effectivity. From Anson Suwaga, VMD, DACVD of the Dog and Cat Dentist, who provided his top 3 tips for pet dental care. Here are those top 3 tips for pet dental care. 1. Dental cleaning. When having your pet's teeth professionally cleaned, expect more than merely a simple process akin to a tooth version of a car wash and detail. While under anesthesia for the cleaning, request dental radiographs or x-rays. Without the addition of this important oral diagnostic test, the veterinary professional will be unable to assess the bone level around the teeth, an important criteria in determining a tooth's periodontal disease status and what treatment beyond cleaning is necessary. For example, periodontal surgery or extractions. Number 2. Tooth brushing. Tooth brushing ideally should be performed daily. We recommend using a traditional flat profile toothbrush, and if a paste is used, choose a veterinary product. Human toothpaste contains fluoride and foaming agents that may be toxic or upsetting to your pet's gastrointestinal tract if ingested. It is not necessary to use a paste, although the flavoring like poultry, beef, etc., may be helpful in encouraging good behavior when brushing. That said, many people find that their dog chews on the brush to eat the paste, and if that is more distracting than helpful. Therefore, using a water-moistened brush and simply offering a small amount of paste as a treat after brushing may ultimately be a better approach. Regarding brushing technique, we recommend directing the bristles of the brush at a 45-degree angle. The tips of the bristles should be angled toward the gum line, and a horizontal motion should be used. Strive for efficiency by brushing sets of teeth, for example, all 6 incisors as one set, canines and premolars as another set, etc. Lastly, avoid simply rushing up to your pet and ripping open the mouth to brush. Instead, gently lift your pet's lip and introduce the brush head into the mouth. Number 3, dental treats. Treats such as hard plastic bones, sterilized real bones, ice cubes, cow hooves, antlers, and bully sticks are too hard for your pet and may cause tooth fractures. Dental treats that have received the registered seal by the Veterinary Oral Health Council are recommended. The VOHC is an organization that exists to recognize products that meet preset standards of plaque and tartar calculus retardation in dogs and cats. Products are awarded the VOH seal of acceptance following review of data from trials conducted according to VOHC protocols. Submissions of results of clinical trials to the VOHC on behalf of a product is voluntary. VOHC is an excellent resource for dental diets, treats, water additives, gels, toothpaste, and tooth coatings that help retard plaque and tartar on the teeth of animals. Question number 10. What flea and tick treatments and heartworm treatments do you recommend? Dr. Chris Byrne, editor of A Vet's Guide to Life and veterinarian at Banfield Pet Hospital, says heartworm treatment. Personally, I really love ProHeart. This is an injectable heartworm preventative for dogs that lasts 6 months with a single shot. From what I understand, outside of the U.S., it is frequently used at a higher dose and lasts for a full year. I wish we had that here. I'd love this prevention because you only have to worry about it twice a year. It's so easy for people to forget a monthly pill, and this keeps that from happening. Veterinarians can include this in their preventative care reminders, easily contacting clients when another dose is due. This is the preventative I give to my own dogs. If ProHeart wasn't available, I would use Trifexis. I think this is a very safe product despite the unwarranted media and internet hype about it. I like the fact that it covers heartworms, fleas, hookworms, roundworms, and whipworms. It's the only product on the market to do all of that. Centennial doesn't count. It prevents flea eggs from hatching but doesn't actually kill adult fleas, and it has the same heartworm preventative found in the Trifexis. There are a plethora of monthly pills similar to HeartGuard, Ivorheart, TriHeart, and several others that use the exact same combination of ivermectin and Pyrantel to protect against heartworms, roundworms, and hookworms. All of them are equally effective, only differing in cost and brand name. There's nothing wrong with any of them, and they all are still an important staple of heartworm prevention. Flea and tick prevention, there are many more choices in this category, and it can get very overwhelming. Do a search on the doctor's blog for fleas, and you will get lots of details that he has written over the years on proper flea control. He goes on to say, this time I'm focusing on specific products, but please read some of my other posts as no product will be 100% effective. And there are many, many things that can lead to a persistent flea problem, even if the product is working well. As he mentioned earlier, he's a big fan of Trifexis. In his case, since he's using ProHeart for heartworms, he goes on to say that I use other products to control fleas and ticks. I really like Comfortis, which is the same flea control ingredient found in Trifexis. Dermatology specialists tend to like this product for dogs allergic to fleas since it kills so fast and so thoroughly. The only downside of Comfortis is that it doesn't do anything for ticks, neither does Trifexis. If your dog really doesn't go near places with ticks, this is an excellent choice. If you worry about ticks as well, I'd recommend something else. My favorite topical products are Advantage for fleas only, Canine Advantix for fleas and ticks, and Vectra 3D fleas and ticks, sold under the brand name First Shield Trio in the Banfield Pet Hospital chain, but it is the same product. Currently, I'm using Vectra on my dogs, but I think that the Bayer products work as well, and I'm happy to recommend them to clients. Advantage has been shown to be safe in most small animals, so it can actually be used on rabbits, ferrets, and guinea pigs, though this is off-label and not officially approved for these species. The products combined with heartworm prevention, Advantage Multi, and Revolution are just as effective against fleas as the non-heartworm equivalents. On your next visit to the vet, be sure to ask your vet these 10 important questions so that you can work together to keep your dog happy and healthy for many years to come. And one last thing, did you know that the single best thing you can do to help our show out is to tell your friends about it and ask them to check it out too? Please do that for us, okay? I'm Michele Forto for DogWorks Radio. See you next time.
This episode of the podcast is sponsored by First Paw Coffee Company. Learn more at firstpaw.coffee.
From First Paw Media, this is DogWorks Radio. We hope you enjoyed this podcast, and we invite you to subscribe in Apple Podcasts, Spotify, Stitcher, or wherever you get your podcasts. You'll find a link on the episode notes. You can tap or swipe on the episode cover art, and you'll see some offers from our sponsors. You can support our show by supporting them. If you like what you have heard, we would love it if you could give us a 5-star rating and tell your friends how to subscribe too. Your hosts are Robert and Michele Forto. Our producer is Robert Forto and created for First Paw Media. Did you know that Alaska Dog Works trains service dogs for those in need throughout North America? Each and every service dog that is trained through the Lead Dog Service Dog Program and Michele Forto and her team has an individual training plan. We train for autistic, mobility, psychiatric, and PTSD for our soldiers for service work. If you know of someone that may need a service dog, please take a moment and check out Alaska Dog Works on social media and at alaskadogworks.com.